Hey, welcome back. And joining us this morning from the Retreat Aesthetic and Vitality Center, we have Dr. Amy Vaughan and nurse practitioner Denise Russell. Welcome back. Good to see you all again.
Thanks for having us.
Yes, and I want to, I guess, add on to the conversation we started the other day here, talking about hormone imbalance and what you all can provide there. So when people start to notice things are changing, is there a certain age that we start noticing all of this?
Right, so most commonly everyone feels that females particularly go through menopause changes mid-40s to mid-50s. But the reality is that a lot of females can, and even males as well, can start to really feel changes in their hormones and imbalanced symptoms as early as mid-30s. Really? Sometimes 10 years before they actually are really starting, to go through those major changes. Yeah. So some people experience those really severe, and it can really affect their quality of life. So those are the people we really want to, let them know that we're here to help and listen to them and, make them feel validated and heard. Yeah, you don't have to put it off thinking, well, this is just what you go through and changes you just have to put up with as you get older. But what can you all do for people?
Well, first we want to do a full evaluation, meaning blood work. Okay. We do a fairly extensive panel looking at all aspects of not only hormones, but thyroid, basic blood work, vitamin D levels. We look at where they are in their cycle. We also look at liver function, kidney function, just a complete profile, plus an extensive history, what medicines are on. Medicines play such a key, they impact hormones as well. And somebody may have thyroid disease, which then directly will impact their hormones from their estrogen, progesterone, or testosterone levels.
So it sounds like it's a good idea to get all this blood work done anyway, regardless of whether you feel off balance a little bit in your hormones. It's just good to find out what all is going on at this point in your life.
Exactly.
Right. So then once you do all this extensive blood work and consultation, talk about the treatments that you all offer.
Right, so when patients get their blood work drawn about a week before our consultation, Dr. Vaughan and I will sit down with them at their consult, go over all of their lab results, go over some recommendations with the patients, lay out a thorough plan of care, but we want to make sure our patients feel like they're part of that plan of care. So
that's nice.
It's kind of very individualized and tailored to fit each patient's needs, and also very symptom driven. So one person may feel great at a certain level of their hormones, and another person may need a little boost to help them feel a little better. So we just want our patients to really feel like we're, hearing them and, giving them a comfortable space to speak about these kind of issues.
And then if they do need a little boost in their hormones, what do you do?
We then we schedule a follow-up appointment, and we can boost them. Again, keeping that constant communication. Okay, we've boosted you. How do you feel now? And then it may be they feel great, and then we follow up again in 3 months to 6 months for men. Others, we may need to look at thyroid as well. We may need also to look at where they are weight-wise. I mean, they may need other options and other guidance in other places to feel better.
Well, that is great. So if someone wants to come in, they would like to maybe schedule a consult or just kind of check and see what services you all offer, what's the best way to do this?
Give us a call. You can also get on retreattristate.com and schedule an appointment, or give us a call, and we'd be happy to sit down with you and just talk about not only cosmetic things, things like cool sculpting and Morpheus, and but all the other avenues that we can explore with you.
Yeah, it sounds like you can do a lot of things there.
Absolutely.
Lots of services.
We love helping people feel good on the outside and on the inside.
Yeah, that is great. Well, Dr. Vaughan and Denise, thanks so much for stopping by and giving us an update on hormones and all the other procedures and services you offer.
Thank you. Thanks for having us.
All righty. All right, stick around. Up next.